Healthcare providers, and that includes physicians, nurses, other clinicians, as well as hospitals and clinics, are subject to the information blocking regulations. And there are others, such as the developer of certified health IT, a health information network, or a health information exchange, who are also subject to information blocking, and you can find out more about that on healthit.gov. Together, everyone subject to the information blocking regulations are known as actors. Now, let's turn back to the question. What is information blocking? First, we must understand and acknowledge that patients have the right to see the health information that their providers have about them. They also have the right to share health information with other physicians or care organizations. Care delivery is best when information is not blocked and providers have all the relevant clinical records at their disposal. In order for an act or an omission to be considered information blocking, it has to meet all the elements of the information blocking definition. That is, it must be done by an information blocking actor. It must involve electronic health information. It must be likely to interfere with the access, exchange, or the use of electronic health information. If the actor is a provider, they must know that the practice is unreasonable and likely to interfere with the access, exchange, and use of electronic health information. But other actors, such as a health IT developer, a health information network, or a health information exchange, it's enough that they should know that the practice is likely to interfere with the use, access, or exchange of electronic health information. Finally, it must not be required by law, and it must not be covered by an information blocking exception. A practice must meet all of these elements of the information blocking definition in order to be considered information blocking. When we think about compliance with these regulations, we want to think about avoiding practices that might satisfy all of the elements of the information blocking definition. For example, as a physician, I want to avoid doing something that would likely interfere with the access, exchange, or use of electronic health information that I know is unreasonable, not required by law, or covered by an information blocking exception. Remember, this information belongs to the patient and should be available whenever and wherever is needed, according to applicable law and patient preferences. And finally, I want to mention two more points. The information blocking exceptions are voluntary, and they offer you an assurance that things you do which meet the conditions of an exception will not be considered information blocking. But even if something that is done does not meet an exception to information blocking, it does not automatically mean information blocking has occurred. Instead, the facts and circumstances of each situation or allegation would need to be evaluated on a case-by-case basis. So whether a practice constitutes information blocking depends on the unique facts and circumstances of the practice. Second, we should all think about this as helping to promote information sharing, namely promoting the lawful, appropriate sharing of electronic health information when and where is needed. In order to facilitate sharing, each of us must look at our own practice and ask, are the procedures in my office or clinic optimized for me, our patients, and my staff to access, exchange, and use electronic health information whenever it's legally permissible? Are we making the most of our capabilities? And am I empowering our clinical and non-clinical staff to help patients understand when and how they can choose to access their electronic health information?